Our scientific understanding of how ocean heat translates into public health harms has advanced rapidly, but it is riddled with critical blind spots, and the consequences of those gaps are not theoretical. The ocean stores the majority of excess planetary heat and is increasingly behaving like a delayed amplifier of human suffering. We know enough to be terrified. Marine heat waves precede land heat extremes. Warm coastal waters expand disease ranges. Coral and plankton collapse undermines protein supplies, and compound events, heat plus drought plus flood, cascade into simultaneous health crises. Yet the research landscape is uneven, heavily biased toward well-instrumented regions and physical oceanography, and too sparse where the human impacts are most acute. Filling those gaps is urgent because delayed knowledge equals delayed action, and delayed action equals preventable deaths, broken health systems, and entrenched inequality. At the observational level, oceanography has sophisticated tools, satellites, Argo floats, gliders, but coverage remains patchy in some basins and largely absent in many low-income coastal regions. Subsurface heat content and its pathways to surface release are still poorly resolved at the spatial and temporal scales that matter for human health prediction. We need far denser, cheaper, and more sustained in-water observations tied explicitly to health surveillance. Without better monitoring of subsurface heat anomalies and their precursors, early warning windows for heat waves and disease outbreaks will remain too short for effective public health responses in many places. On the modeling side, coupled ocean-atmosphere, health models are embryonic. Climate models can simulate large-scale circulation changes and marine heat waves, but they often do not translate outputs into health-relevant metrics, wet bulb exposures, hospital admission probabilities, pathogen proliferation indices. There is a pressing need for integrated models that couple ocean dynamics to fine-scale weather, hydrology, crop yields, fisheries, and epidemiological outcomes. Improving predictability of abrupt ocean heat releases and their teleconnections, how a pulse in one basin affects rainfall, humidity, and vector ecology in distant regions, must be a priority. Current scenario projections that ignore stored ocean heat risk underestimating near-term health burden and misallocating adaptation resources. Epidemiologically, the evidence linking ocean signals to specific health outcomes is fragmented. There are strong case studies: Vibrio expansion with warming coastal waters, harmful algal bloom poisoning, coral reef loss, and fisheries declines, but they are geographically limited and rarely quantified in unified metrics that health practitioners can act on. We lack longitudinal cohort data that track exposure to ocean-driven environmental change alongside clinical outcomes. We need prospective, population-based surveillance that integrates oceanographic indices with hospital admissions, nutrition status, and mental health indicators. Without such datasets, causation remains contested, early warning thresholds cannot be standardized, and interventions cannot be properly targeted or evaluated. Nutrition and food system research is another gaping hole. The mechanisms by which sudden ocean warming synchronizes crop and fishery failures, and how those synchronous shocks propagate through trade, prices, and household diets, are not well quantified. Few studies model simultaneous multi-region harvest shortfalls and their effects on micronutrient supply, child growth, and maternal health. Research must move beyond yield estimates to analyze dietary quality, substitution patterns, market responses, and the time lags between production shocks and public health impacts. Vector-borne and waterborne disease research has made important strides, yet important uncertainties remain about pathogen evolution and novel exposure pathways under rapid ocean warming. How will warming alter the seasonality and competence of vectors in temperate zones? And how will human migration patterns interact with these shifts to create new transmission networks? How quickly will pathogenic marine bacteria adapt and spread into previously safe food and recreational waters? Genomic surveillance of marine pathogens and coupled ecological epidemiological studies are essential to anticipate and mitigate emerging threats. Mental health and social research is severely underfunded relative to its likely burden. The psychological effects of losing livelihoods, homes, and cultural anchors to ocean change, alongside chronic climate anxiety, are recognized but poorly measured. We need standardized instruments to track climate-related mental health outcomes and intervention trials to test community-level psychosocial supports, yet funding and academic attention lag far behind. Health system and implementation research is desperately needed. How should clinics remodel to handle repeated heat surges? What are the cost-effectiveness and equity implications of different cooling strategies, community shelters, home retrofits, subsidized electricity, in low-resource settings? Which surveillance architectures best integrate ocean data into health alerts so clinics can pre-position supplies and staff? Answering these operational questions requires implementation trials, economic analyses, and governance studies that include equity and human rights dimensions. Methodological priorities are clear. Standardize exposure metrics, e.g., ocean heat content indices tied to wet bulb thresholds, create interoperable data platforms linking oceanographic and health records, expand sentinel surveillance in vulnerable regions, and invest in coupled predictive models with forecast horizons useful to public health, days to months. Mixed methods, combining remote sensing, localized in situ measurements, genomic pathogen tracking, epidemiological cohorts, and social science, must become the norm, not the exception. Equity and ethics must be central. Research agendas to date have emphasized high-income interests and physical processes. They have underinvested in the populations that will bear the brunt. Funding priorities must shift to build capacity in low- and middle-income countries, support community-led monitoring, and ensure data sovereignty and benefit sharing. Otherwise, knowledge will be produced elsewhere and applied poorly where it is needed most, perpetuating a form of climate injustice. Finally, there are urgent governance and communication research needs. How best to translate oceanographic early warnings into public health action? Who is responsible for fusion centers that integrate ocean and health data, and how are thresholds for action set equitably? Research on risk communication, false alarm management, and political economy of adaptation finance is essential because better science without institutional pathways to act is morally hollow. The negative trajectory is stark. If these research gaps remain unfilled, societies will continue to underestimate near-term risks and misdirect scarce adaptation funds. Health systems will be surprised by synchronized shocks, supply chains will fail under concurrent stressors, and vulnerable populations will continue to suffer preventable morbidity and mortality. The science is not merely academic, it is the basis for life-saving policy. Prioritizing integrated observation, coupled predictive modeling, epidemiological cohorts, nutrition and fisheries impacts, pathogen evolution studies, mental health research, implementation trials, and equitable capacity building is not optional, it is urgent. Time is short, and the ocean's stored heat will not wait for incremental science.